I'm the Chief Operating Officer here at Vancouver Coastal Health Richmond. In this role, I have responsibility for ensuring that our healthcare professionals here that work in Richmond have all of the tools and the resources that they need to deliver the best possible care. One of the great things about the Richmond community is the diversity of the culture that exists within Richmond. As you know, Canada is a very multicultural place, and Richmond actually is quite reflective of the multiculturalism that we see in Canada. The other great thing about Richmond is the interconnectivity of the community and the tight linkages within the community. And one of the greatest things, I think, of the healthcare that we deliver here in Richmond is the passion and the commitment that our staff here in Richmond provide in terms of the delivery of care for our patients. Well, I think most certainly we are starting to see some traction. So with the emergency renovations that have been in place, we've started to see some real improvements in the service and the quality that we're able to provide in the emergency room. From the medical imaging perspective, that department has world-class equipment. From the CT scanner to the MRI to the ultrasound units that we have there, we're providing the best imaging that's available to us. And certainly with our operating rooms and the minimally invasive surgical suites that we'll be putting in place, we'll be providing world-class service here. And so those investments are clear and evident when people come into the hospital and take a look at those areas where we've made the investments. And then when you look at the areas where we haven't made the investments, you can see that there's some work for us to do in those areas as well. There has been a perception that Richmond has been done without. Certainly from the perspective of the availability of capital resources, it has been a very challenging time for healthcare across British Columbia in that the availability of capital funds has been very limited. And so Richmond as a community has struggled with that lack of availability of capital dollars. We have a fabulous team here that's just working in a difficult environment, and I aim to change that. The foundation and community donors are absolutely instrumental in driving change and driving innovation within the organization. Without the donations coming from our donors, we would be quite challenged. And I'll give you a good example. What we tend to see in healthcare is when we have significant donations from the community, it tends to drive government allocation of funds. So the government really likes to partner with community donors and community leaders to move healthcare initiatives forward. So in my experience over the last number of years, I've seen a number of projects move up in the queue when community donors have stepped forward and really provided that catalyst investment and really allowed that community to drive the innovation forward. I would say the top priority for Richmond Health Services over the next 5 to 10 years will be a critical care tower for Richmond. Followed by the need for additional residential care facilities across the continuum of care. Mental health is another area that we will be focusing on as a top priority as well. Well, it makes me feel very proud to see that the foundation and the community is starting to really swell up behind the hospital and the healthcare services that we provide in Richmond. It's a proud moment, I think, for all of us to see that the community really supports the healthcare delivery within this community. It's a wonderful thing to see the care and commitment that we see, not only from our staff, but from the community in the provision of the best healthcare possible. So if I could speak to the donors, I would say thank you for being part of our community. Thank you for being part of the healthcare team, and thank you for helping us continue to innovate and drive the best healthcare possible here in Richmond.